So this type of therapy can reduce your medication for long time, and this is like what the people will be there. So they'll be like have to lie down in the couch like this, and they will be connected to ECG monitors, and a monitor will be there. So it is actually RWA gating which sequentially inflates and deflates the lower limbs. So how the ECP works is the ECP treatment applies pressure to blood vessels in your lower limbs. So the pressure increases blood flow back to your heart, so your heart works better. When your heart pumps better, symptoms ease. So this type of a therapy can also to encourage blood vessels to open new pathways for blood to flow your heart. So these pathways eventually become natural bypass vessels that help relieve symptoms of angina if your coronary arteries are narrowed or blocked. So now this is the basic of ECG. So what will we do in this? Who is eligible for ECP therapy? So who are having a long-term chest pain or pressure that comes and going doing physical activity, no longer experience relief with medication, and don't qualify for an invasive procedure like surgery, stenting, everything, then they experience newer symptom after an invasive procedure such as bypass, angioplasty, or stenting. So whenever you have a patient after 2 years, 2 months, 3 months, or 2 years, if they again coming with the angina after a stent or angioplasty or anything, so then they are not fit for any other treatment, then ECP will be a useful tool for them. So who cannot do the ECP? When you have a aortic insufficiency, atrial fibrillation, blood clots, congenital heart disease, when you have a severe dilated cardiomyopathy, when you have a heart valve disease, hemorrhage, or high blood pressure, false heart rate, hypertrophic cardiomyopathy, then pulmonary hypertension, severe peripheral vascular disease. So these are all the contraindications for the ECP. So what happens during the ECP treatment? So why this ECP is very important? So during the ECP therapy, you relax on a paddle table, which air fills the cuffs around your lower limbs. So you will feel the cuffs grow tighter. So the patient feels they reach the treatment pressure. Usually we go up to 200 to 300 mg of mercury pressure. So it will all will be in the monitor, and it will be monitored by the technician or the doctor who did the ECP. So you have to synchronize with the ECG and the blood pressure. So synchronized inflation and deflation with your heartbeat. The cuffs inflate as soon as your heart rests, increasing blood supply to the arteries that deliver blood to your heart. So then quickly deflate to make it easier for the heart to pump again. So it coincidentally with the coincidence, and it goes with the cardiac cycle. So once you have deflate inflation, it's a diastolic and systolic inflation deflation. So during systole, your heart will go to that. So during diastole, the R wave gating is there. So automatically when you give a good pressure, so your diastolic during the diastolic period, your heart will get a good supply. So accordingly your blood supply will also there. So once you get to the sensation, therapy should be comfortable. So it shouldn't cause pain or discomfort. You can return to home. This is for the patients. So this is what we can have. So there is a deflation, inflation, and step 2, there is a deflation, inflation of the lower limbs, and there is inflation of upper limbs, and inflation of the abdominal cup, and it will go to the cardiac cycle. So this is the same. This is the diastolic inflation, and this is the systolic deflation. So whenever you have upper thigh cup, lower thigh cup, so it will be gated on the R wave. So when we have a systolic deflation, definitely it will go to the R wave gating, and it will give you a diastolic augmentation. So here the diastolic augmentation is very, very important. So how long the ECP will go means the ECP therapy is an outpatient treatment. So you can actually have it for total 35 hours, 1 hour a day, 5 days or 6 days a week for 7 weeks. So we will have it twice daily or for 3.5 weeks. You can have 1 hour session, a break, and then another session. Now there are a lot of protocols coming, because sometimes patient may have not much time and they will be coming from other symptoms like anything. So what we will do is we will go for a twice a day sitting. So usually morning we do a 1 hour session, and after 3-4 hours we'll do a second session. So usually within some 3.5 weeks we can able to finish the entire 35 hours treatment. So what are all the advantages of ECP therapy? So research shows that improved symptoms for up to few hours after ECP treatment. They say fewer or lesser symptom of angina, including chest pain, They have increased energy since it is ATP enhancer and more ability to active or exercise without any symptoms. So there is reduced need of medication. So this is the importance of ECP. So this is how it also goes. So when you have the diastolic enhancement during ECP, now you can see this wave. So this is the typical diastolic augmentation which you will be receiving. So it shows that your augmentation is good, your diastolic augmentation is good, and also now your heart is getting a good flow of blood flow. So it will increase the microvascular circulation or the collateral blood flow. So this is what happens before the ECP and after the ECP. So when you have a damaged heart muscle due to heart disease, when we have the natural bypass or the angiogenesis after the ECP treatment, so this is the better benefit of the ECP. So is there any complications during the ECP therapy? Actually, complications are usually minor, may it's a discomfort or very, very less. So actually, I have not seen anything except some blisters or bruises. So it has to be given with a good underarms settings or a good pants or like anything. There may be some edema, fatigue, muscle or joint pain, but numbing or tingling sensation may be there. Pressure sores usually I don't see. But usually these bruises will be very common, but after few sittings and anything, it will go. Muscle pain or joint pain also, we have to reassure the patient also. So these are all the basic of the ECP therapy. Since due to the time availability, I'm just cutting short all my results. So ECP therapy is for the people who have not undergone a surgery or a therapy, still have the angina, then it is very important. And also who have a complicated angina after any surgery or are unfit for surgery, then this ECP therapy is very, very important. So thank you, CARDIOZONE organizers, for this opportunity. Sorry, due to some technical defaults, I couldn't make it fully. So thank you very much. So if any questions you can ask. So this is the small glimpse of the ECP. Yeah, thank you very much.
Very beautifully presented on a topic on EECP, Dr. Mohan. Very well explained with diagrams and your personal experience. And few questions. Yeah. Can we do this EECP on renal dysfunction patients, please?
Yeah, renal dysfunction, it gives you a very good results. Actually, with LV dysfunction, long-term diabetic, with diabetic neuropathy, and also with CKD we can do. But only thing, they should not be on any dialysis. Because sometimes usually I avoid because there may be some catheters in there or there may be some AV fistula. So in that cases we avoid. Otherwise with the normal grade 1 or grade 2 CKDs we can do, because when you give the ECP, not only it gives some circulation to the heart, it also gives good microcirculation to the kidneys and brain also. And also we are doing it for the stroke patients, Parkinson's, and restless syndrome, and even for diabetic neuropathy, it will give you a very good results.
Beautiful, beautiful. What would be the approximate cost in your treatment center, sir?
Actually, it is depends on settings. Actually, the international protocol is 35 sittings, total sitting sessions. So each center costs between 1,500 to 2,500 to 3,000. So usually it will be around some 70 to 1 lakh rupees for the entire treatment. Yeah.
Okay. So it is approved by our Indian insurance companies?
Approved by Government of India, and it is there. Actually, in Tamil Nadu, it is included in the scheme also, Minister scheme. But now it is done only in the GH setup, but not for the private setup. Now they stopped. Actually, insurance now they stopped also, but it is approved therapy by Government of India. Yeah.
Beautiful. So EECP is an option for patients with no option, as Dr. Mohan sir very well expressed. In Indian diabetics, we all have smaller blood vessels. So when CABG is not possible, when stenting is not possible by drug-eluting stents, by our catheterization, these people definitely have very good blood circulation where dormant vessels are open by your beautiful EECP procedure. So success rate is around 95%. That's what they say. And I was just going through a few articles. They say this is secret cardiology. not many cardiologists are willing to come out with this EECP treatment.
Yes.
Because their invasive procedures and bypass procedures will take a backlog. So being clinical cardiologists, I think we can still motivate people, organize more sessions.
Yes.
Dr. Vineet is there. He can also help, and we can have a separate forum, and we are still waiting for our results from the Delhi top people. So it's a wonderful session, allowing us to be there as a panelist, Dr. Jagnany, and being along with you on the Independence Day. Thank you very much, Mohan.
Yeah.
Thank you, Dr. Jagnany. Thank you, my dear cardiology friends.
Yeah.
Dr. Jaishankar is very eagerly waiting. Hi, Jay.
Okay, thank you, Jagnany, and thank you, Prabhu. Yeah.
Thank you.
Yeah.
Thank you so much.
Yeah.
Requesting you to kindly withdraw your presentation.
Thank you. Yeah.